Hello friends, welcome back to my channel. Today in this video, as the title is suggesting, I'll be talking about one of the most difficult OSCEs, which is regional analgesia. This I also found it very difficult. So let's get started. So what is this? So in the OSCE station, you may have given the machine the pictures, or you may have to label it. So you have to name this, and it you can write down relative analgesia machine or conscious sedation machine. Both of them they will be correct. We'll start it in the order. So in this head, can you see this is the on the right side there is a glass like thing which is mixer headset. It will be giving you the readings of mixing the oxygen of the gases. Okay, so this is mixer headset. Then this knob, it is flow meter. Okay, here comes the, if I zoom it, can you see this? This is the pressure gauge. Okay, and then this blue bag, it is the reservoir bag. Then there are four cylinders, two oxygen and two nitrous oxide cylinders are there. So the one at the back, that is called the reserve cylinder, and in front that is in use. Okay, the oxygen cylinder which is in use. And you can check the colors to mark it. These are color coded. Okay, and now if we look here, there is a white cylinder kind of thing which is attached here, and this is called the scavenging unit. Okay, and this blue one is nitrous oxygen cylinder. It's not difficult, just take a minute, have a look. Just for the ease again, the four cylinders are there, two at the back they are reserve cylinders, and two in front they are in use. Blue color is nitrous oxide, black with white shoulder is oxygen. Okay, and then white cylinder, small one in between these two in the machine, that is the scavenging unit. This is the reservoir bag. And then let's come to the head. And one more thing is left here, that is the pressure gauges which are attached to the cylinders. Okay, that's little below, at the level little below than the head. So in the head there is a knob which is called flow meter, and then there is there is some markings there, if which is called the mixer headset. Okay, so this is all in all the conscious sedation machine. All right, let's talk about the machine checks. It's important to check the machine before starting any procedure. Okay, logical way of remembering all the steps, it is to have a look at the machine itself and then relate all the checks to the relate all those checks to the parts of the machine. So one is the mixer headset. So we have to check the ventilation system, okay, for them. Then we check the flow meter, test the flow meter whether that's working or not. Test the pressure gauges before starting it. Okay, you have to check the reservoir bag as well. There should be no leak there. Okay, yeah, and you should check the extra reserve cylinders, whether do you have extra supply or not. All right, for both the cylinders. Then you should test the scavenging unit as well. You have to check whether it's working or not. Okay, so all these are few checks which you need to do. We will do it in a bit. So it's just the same. Okay, verify the backup ventilation equipment, check oxygen cylinder supply, check the pipeline pressure gauge, test flow meters, test ventilation systems and valves. Then you have to check for the any leaks in the breathing system, adjust and check the scavenging system. Then you have to check, calibrate, and set alarm limits for all the monitors. Okay, and you have to, so when the patient is there, you have to check the nasal masks which are available with the machine. For example, you cannot use the adult nasal mask with on the pediatric patient, so you have to check for that. Okay, check the reservoir bag, check the monitoring systems. Okay, if also once you have finished your operating on the patient will be shifted to the recovery area. So you have to check whether recovery area is equipped, well equipped with whatever may be needed there. All right, emergency suction, oxygen monitoring systems, everything is available in the recovery area. You should also check whether pulse oximeter is there or not available. Okay. Then comes as the patient checks. Once you know your machine is working, you know what you have to do, and everything, all the equipment is fine, then you have to do the patient check. First is identify the patient. You should use the patient identifiers to see the correct patient is on the chair. Okay. Then whether the consent is obtained or not, and whether then not only just the written consent but patient understands the procedure. You have to explain the procedure to the patient again. Okay. And check whether pre-sedation assessment has been done. You have to do the pre-sedation assessment, which is normally done on a visit before. Okay. So that should be done. Then check for the patient's medical history and medications, any medication that patient is regularly taking, or any medical history which you should again check verbally with the patient. Okay. Then you should be sure that a responsible adult escort is available with the patient, because after the procedure patient may not be conscious enough to go home and needs monitoring or observation. So somebody should be there at home to take care of them, and somebody should be with them to carry them there home. Okay. And if somebody is not there, you may have to make some arrangements for their travel. Okay. So always check, ask them responsible adult escort is there or not, and make sure that that escort also understands the procedure and is willing to take the responsibility of the patient. Okay. Once all this is done, then you should check for the nose piece fit. There should be no leakage. Whatever uh, gases are coming, that should be delivered directly to the patient, and there should be no leakage in between. Check the compliance with the pre-treatment instructions. For example, sometimes we have given instructions to the patient not to eat anything but few hours, a couple of hours between, since morning or whatever, the depending on the time prior to the operation. So has patient followed those conditions, those things? Has patient not taken if, like, whatever depending on the patient, has patient followed the instructions or not? Okay. Then check the arrangements to travel by private car or taxi and not public transport. That's what I have already talked about. Okay. I hope this video is helpful to you, and if you like the video, please give me thumbs up, and if you have any queries, leave it in the comment box, or you can email me directly to my email. And yes, that's all for today. Good luck, guys.